Okay, last thing I want to talk with you guys about is going to be your vitamins. And so you should already be on your vitamins. If you're not, we just want to get you started on them. Okay, so as a reminder, the vitamins start day 2 through day 14 after surgery, and they are a lifelong need because you aren't eating as much food, and then particularly you're not eating a whole lot of variety. You're eating mostly protein. So you've got to get those nutrients in from somewhere. So we do recommend bariatric vitamin supplementation. We sell some in our clinic, and so those are the ones I'm going to go over. If you purchase them from our clinic, I'll tell you exactly what you need. So if you have the sleeve, you need to be on daily multivitamin as well as calcium. So this is what it looks like for the capsule vitamin. We have 2 different versions. This one is actually the one without iron. We have a little bit smaller of a bottle that is with iron. It kind of looks about this size. And so if you're taking the one with iron, which you should be unless you have some specific need where you do not need iron. So most of you are going to be on the ones with iron. It's a 1 per day capsule. All right, and keep in mind, if you're on any type of a thyroid medicine, you do want to take your vitamins at least 4 hours away from your thyroid medicine. Okay, so 1 of the capsules a day if you were on the multivitamin with iron. If you happen to be on this one, which does not have iron, then you're going to take 2 per day. Okay, the other thing that you will need is going to be calcium, and that's 1,000 milligrams of calcium citrate. The ones that we sell look something like this. They're 500 milligrams a piece, and so you do want to take 2 of them per day. My recommendation to you is that you do not take them with your multivitamin, and then as well with the 2 per day, take them separately. If you take them at one time, you may not absorb everything. As well, you're more likely to get constipated with that. So that's what the capsule looks like for the sleeve. If you are doing the chewables for the sleeve, they probably look like one of these. You possibly could have done the mixed berry, which is going to look like this. And so with those, all you need is 4 per day total. So you do not need any additional calcium. And my recommendation to you is to take 2 of them twice a day. So you can take 2 with your breakfast, 2 with your dinner, or switch it up. It's up to you, but 4 of these per day, and that's all that you should need for the sleeve. Okay, now for the switch. If you're doing the chewable, this is actually the switch for the capsule, or I'm sorry, the chewable for the switch. And so you would take 4 of these per day, and that would cover you for most everything, but you do still need to take 500 milligrams of the calcium citrate. You're also still going to need to take a daily B complex. We sell the B50 complex. It's this little yellow pill, and you do just take 1 per day on that. So 4 of these per day, 1 of the B complex, and 1 of the calcium, and that takes care of your vitamins if you're doing the chewable version of the switch. Okay, now if you're doing the capsule for the switch, this is most likely the one that you have. It's the Bariatric Advantage Ultra Multi with Iron, and you're going to take 3 of these capsules per day. You're also going to take 3 of the calcium per day. That's 1,500 milligrams a day of the calcium citrate. And then you are as well going to take the 1B complex, the little yellow pill. And so again, same type of thing. You want to separate your multivitamin from the calcium. So you're taking 3 of these and 3 of these. That is kind of a lot. I know that's true. So you can take 2 of these at a time and 2 of these at a time. So my recommendation, take 2 of these at breakfast along with your B complex. And then at lunch, you can take maybe 1 of the calcium, and then at dinner, you can take 2 of the calcium to cover you for the entire day. Now we recently got in another vitamin for the switch that is a capsule. It's a 1 per day capsule. It's a little bit lacking in vitamin K, but most of our patients are okay with that. So you may be taking just 1 of these a day, then you do still also need the 3 calcium, the 1,500 milligrams, and the 1 of the B complex. And similar thing, this does have iron in it, so you've got to take it separately from your calcium and separately from your thyroid medicine if you are taking that. If you didn't notice, I always mentioned taking this in the morning, the little B complex. B vitamins help to convert your food into energy. And so if you're taking this at night, you may notice that you have a little trouble sleeping. So I would recommend taking it in the morning with breakfast, or maybe even at lunch. Just don't take it right before you go to bed. That's the best thing. If you're having any tolerance issues with your vitamins, make sure that you are not taking them on an empty stomach. That's not going to go over well for most people. So even if you're still doing like a protein shake at breakfast, make sure that you at least have some of that protein shake before you take the vitamins. Another thing that you can do to kind of help with the tolerance, you can switch up the routine. So instead of doing your multivitamins in the morning, if you take them in the evening time, kind of with dinner or maybe like right before bed with a small snack, that tends to go over pretty well for most people, and they don't see the nausea or the upset stomach with that. If you're not having any problems, that's great. Just keep on keeping on with your vitamins. They are very important for your long-term success. A couple other things I wanted to mention with vitamins. You may also be taking a probiotic. Probiotics are recommended for everybody, particularly our switch patients, and it's definitely not going to hurt you, but it is not required to maintain your vitamin status. So keep that in mind. If you are not taking a probiotic, that's okay. But if you're having some GI issues, for example, if you're having any bloating or having a lot of gas, having diarrhea, constipation, if you're having any of those things, I would recommend a probiotic. We sell two different kinds. We sell the Celebrate Pre and Probiotic. And basically what that is, the prebiotic is fiber that the good bacteria feeds off of. So this is more of a complete, but you can also do this one. It's a chewable, kind of tastes like a grape. It's actually not bad. And so you would take this and that would cover you for your probiotic. It doesn't have the fiber, but you may not necessarily need that. So it's up to you which one you go with. Those can definitely help to resolve some of those issues that you may be having. And just want to really quick, if any of my ladies or you guys too are worried about hair loss, you're probably not experiencing it just yet, but it's coming. That typically happens with weight loss surgery when you lose weight rapidly. I would say most people are going to start to experience the hair loss around 3 to 6 months, some a little bit later, some a little bit sooner. So what you want to check in with on that is going to be your protein intake. Number one, you've got to be hitting your protein goals. And if you are, that's going to set you up for the best success. Number two, are you taking your vitamins? So the ones that I just mentioned are what you need. Number three, if you feel like you still need a little extra padding, you're really worried about the hair loss or your loose skin or anything like that, there's a couple things you can add. I know a lot of you will want to add biotin. I don't typically recommend that you do just biotin alone. It's not actually shown to improve your hair growth much at all. So we do sell the Sugar Bear hair vitamins. This is just one option. They are a gummy, but they're not super sticky, so they're okay for you to do. You take 2 of them a day. And then that has a lot of different vitamins in it. It has biotin, it has vitamin D, it has vitamin A. And so these are going to be a better option for you than just the biotin. Another option would be like a hair, skin, and nail supplement that you can purchase. My favorite option though, and the one that's probably going to help you the most, is going to be collagen. And so collagen is going to not only help with the health of your hair, growth of your hair, but it's also going to cover your skin as well. And so collagen just kind of helps with the elasticity of your skin to help make sure that it can kind of bounce back. Now, that's not to say that you're not going to have loose skin. You probably are, but this can help you to make sure that you at least have less loose skin or tighter loose skin, if that makes any sense. So collagen is something you can do. Collagen also has protein in it, and so if you're using this, you get a little bit of an extra benefit with the protein. Okay, I think that is about everything that I wanted to talk with you guys about, and so just wanted to encourage you. You're doing amazing. Keep on with the diet. If you don't have that printout, contact our office and we can send it to you. We can email it to you or mail it to you. You can also find it on the Berrytastic app. It's under our handouts, and so you can take a look at that just to kind of remind yourself of what phase of the diet you are on. One thing I did forget to mention, you are technically allowed to have things like your plant proteins, like your beans or your legumes. Here's the reason why I don't want you to be doing a whole lot of them and not doing them very often, because they are very fibrous, especially if you've had the switch. That may cause some excess gas or bloating. And then they also are going to have some carbohydrates in them. So if you are frequently doing like the beans or the pinto beans, the peas, the chickpeas, things like that, if you're frequently doing those things, you may be experiencing some dumping syndrome as a switch patient, or your carbohydrate intake may be higher than we want it to be. So just keep an eye out on that if you are doing those things. They're nice to put in there because it does give you a little bit of variety in a time when you don't have much, but you don't want to do them too often.